All right.
All right, and we're live.
We are live here. So Giacomo Fabrizio and Justin Chan from Nobleton Physiotherapy, Bradford Sports Medicine Professionals, and Aurora Sports Medicine Professionals. So thank you all who are participating. Just waiting for people to come in on this beautiful Thursday evening. It's a beautiful, gorgeous night. Justin and I were just chatting about the last time we did this. It was cold and dark outside, so it was October and we could barely see anything outside. So today's a gorgeous day.
Yeah, just using my natural lights right now. It's pretty good. It's pretty good.
It's the best way to do it. Yeah. So we've got some people streaming in here for the webinar. So thank you for attending so far. We're just going to give this a few minutes, let a bunch of people come in to the webinar. It's not quite 7 o'clock yet, but we thought we'd launch and see if anybody's out there waiting. And we have a couple more people coming in. So Justin has a great webinar prepared for today. And I think everybody who's in attendance will enjoy it. Feel free. We'll go over some of the housekeeping before we get started. But feel free to put your hand up virtually, of course. Or if you want to have the mic, we can give you the mic to talk and ask a question. Or if you want to type into the chat any questions you may have for Justin. We're pretty informal, but at the same time, we want to make sure that we get some questions answered. And if they're not answered, just as a forewarning, if we don't answer them right away, we'll try to answer them on the side. Justin's really good with getting back to everybody personally. So just wait for more people to stream in. Justin, any thoughts on the summer so far?
Well, yeah, I'm excited to try to do my second one right now. So bear with me, trying to give out as much information to you guys as possible to help you guys out as much as possible. If I miss anything, like Jack said, make sure to leave a comment below. We'll try to get back to you. So don't hesitate, just ask. If I cannot get back to you here, I would try to get back to you, with email or a phone call. That would do as well. Okay.
We do have a hand up here, Sherry. If you can hear me, did you want to speak, or did you want us to type something into the chat? I'm not a Zoom expert here, so I just see a hand up. So if you want to type something into the chat, that would be great. All right.
There's a lot of options on Zoom. Yeah. Sometimes we don't. Not tech savvy, but
I know I'm so not tech savvy, so I apologize. I'll probably screw up a poll here and there, so bear with me to the attendees. So it's just 7:02 right now. Thank you for all the attendees so far. We are going to just wait a couple more minutes. So if people want to go grab a glass of water or a glass of wine or something, whatever suits your fancy, we'll tuck in for a presentation. Here's somebody through it. Let me just. That's okay, Sherry. No problem. No problem. That's all good. So we'll just tuck in here. Justin's got a presentation that probably lasts about 30-40 minutes. Justin, what would you say?
Yeah, around that time, and then I'll leave some room for questions at the end as well. Yeah. But you can just type it in whenever you have it. So if it's more urgent, we'll get to it relating to the topic. If not, sometimes we don't get to that. We'll try to answer at the end as much as possible if time allows. But again, I'll definitely try to get back to you regardless, either through email or a phone call as well.
And just for before we get started, just let everybody know that if you do miss part of the presentation or it is summer and people may not be wanting to sit inside on such a gorgeous day. I kind of wish it was raining. We'd have more people attending. But the presentation will be available on all our websites: Bradford sportsmed.ca, aurorasportsmed.ca, and nobletonphysiotherapy.ca. You can check out all of our webinars there, in particular this one tonight, if you miss any of it. So, Justin, without further ado, let's get started. Most of our attendees here are in, and I'm sure they're waiting to hear what you have to say. So I will mute myself because I could keep talking, but I'll give you the floor. Welcome, Justin.
All right. All right. Thank you. Thank you. All right. So welcome again, everyone, to my second webinar. Last time I had one was back in the fall or winter time. So excited to, be back and share some information with you guys. So as you can see by the title today, we're going to talk about some of the most common foot disorders and treatments, available for them. And we're continuing our series on with putting your best foot forward. As I always want you guys to do that. So let's get started. All right, so just a little bit about myself. If you haven't met me yet, I am a chiropodist here at the Aurora Sports Medicine Professionals, also at the Bradford one as well, and Nobleton Physiotherapy. So I am registered with the College of Chiropodists of Ontario. So I got my license a couple of years ago and been practicing since then. I have a kinesiology background before I studied chiropody. And I studied that at U of T. And also I love to hit the gym. You can find me at the gym, almost every day. I like to go do that in the morning before I work. So it's pretty refreshing for me, and then it's good for my health, good for my to refresh my mental state as well, to be prepared for the day. So I love to do that. I'm also a sneakerhead, which is very, very relevant in my opinion to my profession. So I guess, it's a good thing. I get to try a lot of different shoes on. I like to explore around with different sneakers. I'm really passionate about them. So maybe I can give you some insight into some sneakers you guys are looking at as well. And then maybe we can talk about that, see if it's good for you and, how stylish it is. Love to talk about that. And of course, I'm an extrovert. I love to talk. So feel free to, chat me up, even say hi, through an email or phone call. It doesn't have to be something serious. You have to ask me, just, just want to talk and, be friends, right? Be my guest. All right. So who is a chiropodist? A chiropodist is basically a primary healthcare provider, which means that we don't need referrals. We can, see you as long as you book an appointment with us, or sometimes we allow walk-in if our schedule permits. So there's no referral needed from your family doctor. However, of course, sometimes they can refer you to us as well. That's majority of a patient as well. But no, you don't need referrals. That's why we're called the primary healthcare provider. And we provide services basically in the foot itself and the ankle. So anything pertaining to that region is part of my scope of practice. So from nail and skin to orthotics and in office surgeries, I do all of those, relating to the feet. So some of you may wonder again, chiropodist and podiatrist. There's a lot of debate out there. Is, oh, are you a podiatrist? Are you a chiropodist? Are they the same thing? You guys do the same thing, or you guys are completely different, right? Are you a chiropractor? And sorry, is the poll up a little early? That's okay. That's okay. But yes, essentially they are both foot specialists. In Ontario, we still use the term chiropodist. We're pushing for it to change, to keep up with other countries as well, but we're using the term chiropodist. However, from the States, there's podiatrists coming in and they keep their name as podiatrist. And usually that's the difference. We get our education from different, part of the world, but also we do the same thing. They might do a little more in terms of going into the bones through surgeries. We usually like to leave them as chiropodists for, orthopedic surgeons and other professions as well, which we do have in our office as well for consultation. Yeah. So we're gonna have a poll. Next.
Yeah, bear with me here. Sorry, all right. Okay, so if you want to feel free to answer the, oh, I'm really sorry, Justin, here. I think I may have, people want to answer the questions here.
Yeah, hopefully you guys see it on the screen.
Sorry?
They can see it on the screen.
Yeah, they can see that on the screen. Yeah, yeah. I just again, I'm so technologically inept sometimes. I was all right. Okay, pretty good so far. So far, so good. Almost everybody answering the questions here. I'm just waiting another couple seconds. All right. Okay, so there we go. Share the results. So Justin.
Nailed it. Everyone got it right. Yeah.
Yeah, pretty good.
Yes.
Pretty good. All right.
Yeah. So we can do all of the above there. I briefly mentioned it. So good. You guys are listening. We can do soft tissue surgery, orthotics, medication, and many thing else, pertaining to the foot.
All right.
Okay. Slide. Okay. So with that being said, we went through a few of them. On top of that, we also treat diabetic foot care. It's very important that majority of diabetes, some manifestation do exist, in the feet itself, and a lot of people unfortunately neglects that. So it is, our duty and our role to be more adamant about it, to see and check up with you guys, especially people with diabetes, of their feet, right? Because sometimes a little bit of loss of sensation can lead to a wound, and that story goes on to an amputation and sometimes even life-threatening. So it is very important to prevent rather than to react to the situation after it goes out of hand. Okay, so wound care we do, and simple things like corn and callus care, nail care, orthotics, warts, ingrown nails, fungal nails, athlete's foot, some heel, forefoot, and arc pain relating to, maybe your walking pattern or your gait. Many of those, we take care of that in office for you. Okay, so let's dive right into our topic today. We're going to talk about the most common foot conditions. So the first one we're going to talk about is athlete's foot. I'm pretty sure a lot of you guys have heard about that. Some might even think that, I know, all about it. Some might be like, oh, but what's that? Only athletes get it. So here it is. With athlete's foot, it is a term that, since back then, with a little bit of history, a lot of athletes, especially swimmers, or when they back then do sports, a lot of them do it barefoot, and they used to contract the fungal infection in the feet, and they end up with a little bit of fungal infection in the bottom of the feet. And so majority of them were athletes, and hence the term a lot of people call it athlete's foot. So it is a fungal infection. Most people do get it once or twice or something many times more as well. It can recur over their lifetime as well. So it's not that when you treat it once and then it'll be gone forever. It can come back, if it happens to affect you again. So some signs and symptoms you might see with athlete's foot. It looks really common. Some people don't even notice it until I mentioned in the office that you have it. But some pointers here is very, very similar to just dry skin. Some people might have dry skin that they put a lot of cream and they say, it's not going away, it's spreading even more. I don't know what's going on. Sometimes that could be a sign of athlete's foot as well. Okay. Redness also appearing on the foot as well. Sometimes, most of the time, it looks like there's circular lesions on your foot as well, with that scaling pattern appearing as circles on your foot. Not all the time, right? But that's one of them that is kind of popular in a lot of cases. Some of you guys might get itchiness when you have that. It can spread in size into the other foot as well, very contagious, and callus and thicker skin can build up on top of that infection. So how can one contract athlete's foot? So there's a lot of risk factors in contracting this pathology here, such as walking barefoot or in open-toe shoes. Since you're exposed to the environment, to the elements, there's a lot of chances of you catching that fungus on your feet. right? Especially in communal moist environments, with the showers, jacuzzi, the beach, where people share the same space. That's more likely for you to catch it when the other person has it already. So similar at home, some of you might have, um, relatives or with your family members having fungal infection, not just in the foot, but fungal nails as well. Some of those spores or the fungus itself can, lodge onto your feet and find its way in, and you might get affected as well with athlete's foot. So other places that commonly occurs from my patient, we notice that is sometimes they get it from the pedicure, especially those that share a pool of water and they don't rinse it out. Rarely the case. I hope that's not what we're seeing outside, but sometimes there's that possibility of not sanitizing the equipments properly and leaving behind fungal spores. Also sharing towels as well. Good thing with the athlete's foot is pretty easy to treat. Okay, there's some over-the-counter option, such as some creams that you might find. There's a variety of them. They have different mechanisms, but they all either work to stop the spread of the fungus or some directly kills the fungus as well. So some recommendation for me that I find really effective for the athlete's foot or even fungal nail we're going to talk about later on is something you can find over the counter called, it's actually a shampoo. So it's pretty interesting. A lot of people wouldn't think about using a shampoo for your feet, but when you have that shampoo and you mix it with a little bit of water, according to the package there, or just a two teaspoon with a bucket of water, warm water, it bubbles up a little bit, and then you can soak your feet in there, and it just gets all over your foot. Very, very, very effective because it seeps into every part of your foot, right? So it can drives the fungus out, and with over the time you do it through 2 to 3 to 4 weeks, depending on the situation and the condition. Sometimes it's sufficient enough to get rid of the fungus. However, not all cases are treated just with over the counter, right? So that's where we come in, and we can prescribe topical antifungal cream, such as some spray or cream to put on your feet, usually once or twice daily, depending on what we diagnose and see with the severity. And usually that helps to resolve the cases as well. Sometimes with prolonged with the athlete's foot that has been existing for a while, calluses can build up on the surface. Sometimes you see a little more thicker skin, and it's harder for your drug, for the over-the-counter or the prescription drug, to penetrate your callus to get to the infection sometimes. So we advise using some pumice stone or emery boards. You can purchase over the counter as well. After showering, you can gently scrape off some of the calluses. If it's light, that usually does the job pretty well. Or if it's a little more heavier, or without success with the pumice stone, you come into office. Of course, we can help you out with more advanced equipment to file that down and giving you the right prescription for that case as well. So you can see, chiropodist, using blade. Of course, don't let anyone else use a blade on your feet. Only licensed chiropodist or podiatrist should use a blade or a scalpel on your feet. We grind it down on the top right picture there. You can see using a drill. Sometimes that helps to file it down without being too aggressive. Some people are scared of the blade, or if they flinch a lot, at least that's a little safer option. And also, applying the anti-fungal cream as well. So fungal nails, very, very similar to athlete's foot. It's also a fungal infection of the nail this time. However, with fungal nails, it's much harder to treat. Most of you probably know why. If you had it, sometimes you or your family member or relatives have it, it's a pain to treat it because it hides underneath your nail, and your nail is very, very protective in nature. So your nail technically tries to prevent any medication from reaching the fungus, not on purpose. It's just trying to protect, the skin under it from, outside elements such as, if you step in water, and try to prevent that as well, right? So picture the drug, even in its most penetrative solution form, trying to reach that, underneath the whole nail, that would be a little bit harder. Okay, so also with the presentation of it, it can be easily confused with other conditions as well, right? Sometimes with thickened nails from trauma, it looks similar. Some people with psoriasis especially, or lichen planus, if you heard of those conditions, they may have presentation, like a fungal nail, but of course without an infection, but it's more from that other pathology as well. So some signs and symptoms, it may appear very different between individuals because there are some superficial ones and some deeper ones, and they can look a little bit different. So yellow nails are usually common among most people infected with fungal nails. It can be thickened over time. When you cut it, you might notice some powdery, white powdery or crumbly stuff comes out as well. It tends to be pretty brittle, right? With the superficial one, sometimes you might see white spots on your nails that are more superficial. Of course, they're still contagious, so try not to touch that and rub it off with your bare hands. And you would notice that when they get thicker and they become hard to cut. And some of them, as you see on the top picture, after cutting it, or the brittle part falls off, you might notice some longitudinal ridges along the nails as well.
Justin, just a question we had, and it was something to do with prevention. Is this something that you'd recommended, that Nizoral shampoo? Is this something that people should do as a preventative measure, or is there any harm in doing that? I'm just thinking after this question, gosh, that looks terrible. It's hard to treat. Is it something you can do to prevent, like keep your feet dry, or prevent it by once a week using this shampoo?
So that's a good question. With the Nizoral shampoo, first of all, talking about the product there, the being superficial soaks that unless you have skins that have wound, or of course that's not recommended. But it's very hard to just penetrate into your system, and they usually don't do too much harm on the superficial level. So it is good to use without a lot of side effects. However, as a preventive measures, it is kind of expensive to use a even over-the-counter drug as a preventative measure, especially you're not sure if you have it or not. Sometimes you go to the beach and you use that. It might be harsh for some people, especially if they go often as a swimmer or something like that. So I would say there's other preventative measures that are better, such as of course wearing closed-toe shoes. If you anticipate yourself to be barefoot, or go around, in a communal area that a lot of people share, unless even slippers are better than barefoot, along the pool side of the pool. But if you suspect that, you see someone with, let's say, fungal infection, and then you realized after the fact that, oh, we were sharing the same space, then yes, this could be a good option as a quick preventative measure before it gets, you get the infection. But again, we talked about athlete's foot being pretty easy to treat. So I don't think with this condition, too much of the preventative side is necessary. I hate to say that because I'm all for the preventative side of things, but with regards to this condition, not life-threatening, not a severe problem that could be difficult to treat. So it's recommended that you try to keep yourself far from the infection. And if you see other people with it, then protect yourself with closed-toe shoes, socks, whatever have you. But using the drugs, of course, it works. But looking at the cost and value of using this product as a preventative measure might not be the most cost-efficient way. But yes, again, most conditions, prevention definitely, especially fungal nails, right? If you suspect that, then of course soak your feet in that. However, I wouldn't say it's the best way of preventing it by doing it as a ritual or routinely.
Sounds good. Thanks, Justin.
Yeah, no problem. Okay, so continue with the fungal nails. You can see from the images, right? That's just some of the cases that you might see. The most common things: thicken, yellow nails. Of course, the crumbliness is from cutting. Usually, you'll find that out. The top one, being brittle and showing the longitudinal ridges. So that's just some of it. Sometimes it might just look like a small yellow spot, and it's very hard. It's very hard to spot sometimes. If some patients are confused, that's normal, right? Even some of us as practitioners, some appear like other diseases. We have to take the history. We have to might even need to do a specimen to find out if it is really fungally infected, even in the office as well. So again, very similar to athlete's foot. How can we possibly contract it? Of course, having open toe shoes, walking barefoot, sharing communal spaces that are moist and wet are likely, right? Of course, same family member again, within the same household, barefoot, plus different factors. Of course, the more factors that we add in, the higher the possibility. So if you already notice someone has it and you're going into sharing a communal space with them, being in a moist environment, and both of you are not wearing any shoes or slippers, then of course the chances add up there of contracting it. Although having fungal nails contraction is a little harder than athlete's foot, because of course your nail is pretty protective in nature. However, sometimes when it seeps into spots on the side, or you have damaged nails, as we see on the slide, the traumatized nails, it leaves more room or more susceptible to damages done by the fungus, because they can just get right into that, taking that opportunity to infect the nail. Also with ingrown and curved nails as well. So some of you might be born with that or other condition. We're going to talk about that later. But that itself is a higher risk factor of contracting fungal nails when the opportunity presents. So some treatment for fungal nails. Again, it's very hard to treat. So it's the medication might be similar to those that treats the athlete's foot, but the solutions that we prescribe might be a little different. Especially as we wanted to penetrate the nail plate as much as possible. We have, so the over-the-counter ones are usually very, very low effectiveness. You can try that. Some people might find some good results with very superficial ones or very distal ones, meaning that the infection is only along the outer edge. But with prescription ones, sometimes it's a little stronger. It can penetrate a little better. So we tend to try that as the first line of option, since having fungal nails, again, like athlete's foot, is not an imminent threat to your life, or not a serious health issue until unless you're of course with other issues like immunocompromised and status, then that could be a little more severe. But as a regular healthy individual, it's not a huge threat, but it is annoying to get rid of. So having that spray or a nail lacquer, which paints onto your nail, could be a better option, since it stays on the nail, and the spray can seep around the edge of the nail and try to get in as much as possible to kill off the fungus, rather than having the cream base solution. Of course, you can try the foot soaks as well for this one, since soaking your feet is also easy to have that medication get inside underneath the nail as much as possible if there's space to get in. So that's a good option to try as an over-the-counter option as well. For people with multiple infected nails, we should usually, even with the spray, it takes time for your nail to grow out. It doesn't work immediately, so you have to wait for the nail to grow out completely and free of fungus. So think about all that factor in treating it. So how low that effectiveness is compared to having no nails, like the athlete's foot, and treating the condition. So we usually step up a little bit when that doesn't work. There's oral medication, of course, with one nail, usually not recommended because the oral medication does take a toll on your liver. So definitely visit a chiropodist to get assessed it and find out if there's other medications that might interact with this drug, or with other medication uses your liver for metabolism that could really affect your health as well while on both of these drugs. So we might send you off to a liver function test every few months to keep up with that progress. Again, not really recommended, but with some patients having all 10 nails affected or 5 in 1 foot, sometimes they might choose this option because with the other ones, realistically, it's going to take a lot of time or it might just be really painful because you have to go through multiple treatment such as the following: the laser fungal treatment. Not all the clinics offer it. Unfortunately, we don't have it here, but we might in the future. But again, with the laser treatment, of course, the effectiveness really varies depending on the individuals. Not my most recommended one as well. But of course, with multiple nails, people would like to try different things. I think that's one thing you can try. Oral medication is the other. There's hot and cold laser. The only difference between those is that the hot one tends to hurt a little more because it heats up the tissue to try to kill off the fungus. The cold laser is a little better technology, but then of course the cost will be there compared to the hot laser. And it's less common. For the last one, nail removal surgery, again, this would be recommended only for single nail infection. Don't really recommend that for a lot of nails because we're not trying to remove all the nails to treat that infection, especially when it's not an imminent threat to your health or if it's not causing any pain. Oh, sorry. I have a little bit of a poll there.
Justin, so we have, yeah, that's okay. We got our next poll here. So bear with me. I just have to relaunch the poll. Okay, and there we go. I think we can see that now, right there, Justin. Can you see that?
Mm-hmm.
Yeah, good. So if everybody, so just what is the most common cause of heel pain? I think we might have played our card there with that slip of the slide, but see if we get
might not be the answer. There's I might be tricking you guys. They're really close. So
all right, so far we got yeah, there we go. Somebody's okay. All right, so we're gonna end the poll and share the results here. There we go. So
very good answer. So
yeah, those are all like I even see it in our practice that we see that often, but plantar fasciitis is probably the most common cause of heel pain. So those other ones do exist, but yeah, definitely one of the most common causes. So I'll let you get right into that.
They're very close in clinic, but plantar fasciitis, what we're going to talk about, is one of the most common ones that patients show up to the office complaining about heel pain, and majority of them, of course, common doesn't mean more than 50%, right? It's just more common compared to the other ones. So it is better to get it checked up than assuming that it is and then realizing that it gets worse without getting treatment. So but this is just some education for you guys to spot it out and see if that could help you. But of course, visit your local chiropodist, or of course, I'm here to help you guys out. Then get it checked out when you do have heel pain or other conditions as well. So it might be different from what you think, although it might hit most of the signs here, and you might think that, oh, I have this. So just a heads up. So plantar fasciitis, again, very common cause and of heel pain across all age groups. Okay. Usually you might hear the thing from people saying, when I get out of bed, it's so painful, I can barely walk, but then I warm up after a little bit and it's all right. I can get through the day, but then afterwards it hurts again. When I sit down and get up, or when I drive and then get up, the first few steps usually hurt the most. Also, this is a progressive disease without treatment. It can regress with treatment. So this is a very common problem that we have, that when people visit, they usually see a lot of benefits. Okay, they can be diagnosed clinically with us doing the physical palpation and other diagnostic tests, but also with more in-depth X-rays as well, and ultrasound, finding out soft tissue information, or if there's any heel spurs with the X-ray. Fun fact: a lot of people come in thinking that with their X-ray, saying that, oh, I have heel spur, and that oh, I must be the problem causing the pain. But it's just a fun fact for you guys. Now you guys know it is a reaction to plantar fasciitis or other irritation. If it's on the back of your heel, of course, Achilles tendonitis. What a heel spur is basically when you have that inflammation with that tautness and the plantar fascia, it pulls on the bone, right? Your body is smart. It will try to grow a little longer on the bone underneath your heel to try to shorten the distance between of the band. So hopefully trying to relieve some of the pain and resolve that inflammation, that issues. But of course, usually most of the case that doesn't do the job. And don't worry about it, because heel spurs alone does not cause pain. It does not grow perpendicular down, as some people think it might, and then pops out at the bottom, causing a bump or irritation. Most likely they grow parallel to that plantar fascia, which goes across the bottom of your foot. So usually when it pulls, it goes that way. After plantar fasciitis resolves with our treatment or with which we're going to talk about, the heel spurs might still exist, but it won't be a problem usually after that. So some signs and symptoms, we mentioned that in the last slide briefly, but some more in-depth ones includes pain at the bottom of the heel, of course, worse with weight bearing and walking, is swollen, it looks inflamed, it can be very painful even to slight touch, palpation, or even flexing your toes back. Sometimes people find that stretching it hurts a little bit as well. Again, worse first few steps in the morning or after long resting. Usually that pain can be sharp and can be with burning sensation at first as well. Later on, when it becomes more chronic, it can be achy as well. So how does that happen? Of course, with plantar fasciitis, it is inflammation, and with inflammation, usually something triggers it, right? So in this case, there could be micro tears in the plantar fascia, in which the plantar fascia is the band that supports the arch of the foot. When there's overuse, when there's trauma, when there is all of a sudden maybe weight gain, other stuff as well, could trigger that, because putting more stress in the plantar fascia could cause those micro tears to happen. And of course, barefoot walking puts more stress on it, increasing activities on the feet, having weight gain, putting more pressure, flat feet, high arch foot are some of the higher risk factors to developing plantar fasciitis. So with that micro tear, usually, a lot of patients like, why does it hurt the most in the morning then, or after resting? Here it is, because with the plantar fascia, again, your body tries to heal that, right? Overnight, as a quick fix. It tries to lay down scar tissue, fill the void up, and try to patch it up. That's, your body's smart. It's doing the right thing. But of course, before it can get the work done, you step on the ground again. After resting, you stretch that scar tissue, which is very weak. It's not meant to be supportive like the plantar fascia itself with the normal cells. It can rip apart again, causing that really, really painful sensation the first few steps. So it could be a vicious cycle, right? You see, healing, breaking it down without the right support and with all those risk factor, it breaks it down again, heals, breaks down again, but it never heals right? You're left with a lot of scar tissue in the region. So some treatments in the short term that you guys can do at home. Of course, I really recommend this to a lot of patients. They find a lot of good, quick reduction in inflammation. Because even if the physio I really good with prescribing the exercises and stretches to help you out with that as well. So, of course, with the ice rolling of the heel to arch with a frozen water bottle, I recommend a ice water bottle in the initially versus just the plantar fascia ball or massage ball, is because with the iced water bottle, first of all, you can get the reduction in inflammation. Ice helps with cooling down the area. Second, of course, like the massage ball, it helps to soothe the area by massaging it, rolling out the plantar fascia like a stretch, right? Stretching out that, and also sometimes it can help, not a lot, but breaks down a little bit of the scar tissue. That can help as well. Of course, recommended to do it regularly, 15 minutes each session, and about 2 to 3 times daily would be ideal. Along with calf stretches. A lot of people might not know, say, what does the calf has to do with the bottom of the foot? Think about it, right? When you're heel, you have a heel bone. Okay, that's one bone where a lot of stuff attaches. The calf attaches to the bottom. The calf to the back of the heel, and the bottom of your foot, where the plantar fascia is, also originates from the same spot, from the same bone. So they're kind of playing a tug of war when it's tight, right? So stretching of the calves helps release some of the tension that it has on the heel bone, and it will also help with the plantar fascia as well. Okay, and of course, resting once you have that inflammation, resting would be your best friend. Especially breaking down your regular routine into different sessions instead of prolonged activities on feet. You might want to reduce that, or if you can't, try to take breaks in between to maybe perform some of the exercises, stretches, and that could help you. Okay, some were mid-term to long-term. We're custom made orthotics. Okay, very, very good topic here. A lot of people not sure where to get it. One of the really good example of getting orthotics is for this condition is one of the gold standard in a profession in resolving that vicious cycle we talk about, because it offers us support, prevents the breakdown of that plantar fascia as much as possible, and allowing to heal with, of course, your short-term method of restoring the inflammation, and of course with the in-clinic treatment as well. All together can, with the short and long term, preventing and restoring together would be your best friend. So it breaks that vicious cycle down. Next thing is extracorporeal shockwave therapy. What that is we do offer it in our clinic at Aurora location. We do have that shockwave, and with that shockwave, what it does is it helps with the a lot of things in the region of the plantar fascia. It helps to break down the scar tissue. It helps to promote healing in the area. Usually, it is recommended that after 4 to 6 sessions, and then we reassess to see the benefits of it. It doesn't take only 1 session to completely restore it usually. So it might, but very rarely the case. So we do recommend that protocol. But of course, every time you're here, we reassess it to see where your progression is, and then we adjust from there. And then taking a step further, of course, these are not non-invasive one now. These are more invasive, and only if the previous treatments fail. However, good news is that with the all the treatments that I mentioned before, 90% to 95% of the time, most individuals resolve with that, with those treatments. With the icing, stretching, shockwave, orthotics. But of course, with that failing, there's of course the invasive treatment where there's corticosteroid injections, which we can do in office, and that helps to relieve the pain and reduce the inflammation, allowing you to heal a little better and not go through that pain and that cycle, and allowing you to have that proper rest. And with the other treatments with it, of course, that can help. And at last, we have our plantar fascia release surgery. Only if all else fails, then we go there. Only 5% of the individuals really need this surgery. Usually less than that, but 5% I'm talking about of the population of individual who has plantar fasciitis. So very, very little compared to people who have heel pain in general, requires any surgery in that region. Okay. I'm always ahead of myself. There's another poll that we have here.
That's okay, Justin. No worries, no worries. So
I feel like the polls right now
get to
are,
our
yeah, just to try to keep you guys engaged, making sure that you guys are listening. So,
all right, there we go. So which of the following is the most common in office procedure? So we got ingrown nail surgery, bunion surgery, hammer toe surgery, and cyst removal. Okay, so. Yeah, before I met Justin, I didn't know that some of this stuff was done. I mean, other than ingrown nail surgery, that some of the stuff was done in office. So it's a little bit. It was a little bit of an education for me as well. All right, so I'm going to end the poll here. Share the results. So there we go. Ingrown nail surgery. Bunion surgery is and cyst removal. So, but nobody picked hammer toe surgery, Justin.
good. All right. So,
I will
yep,
exit the
majority of you
poll.
guys got it. Yeah, it's the ingrown nail surgery is the one of the most common one that we do in office. Next to that would be sometimes with the hammer toe surgery. Actually, is releasing it, straightening out. It's also pretty common in office as well. Cyst removal follows. And bunions usually are more complicated, and we usually either go into an OR where we can do the surgery there, but most of the time we might refer to orthopedic surgeon if the bones are involved in the development of that severe bunions. Then we tend to have that done as well. But with sometimes soft tissues induced at bunions, which is very minor stage, and if it's based on really tight tendons that are causing that, of course, quick fix could be done in office. So let's go ahead and talk about the ingrown nails, which is very common. What that is the corner or side of a toenail grows into the soft flesh surrounding the nail. Very, very painful, could be debilitating to daily activities. I have, surprisingly, a lot of children, younger teens having this problem, and they have trouble even walking, let alone playing sports, and their quality of life just goes downhill from there before seeing me. And they their parents are really worried that they cannot do any sports, they cannot even run with the other kids, and that could be pretty debilitating, not just to walking itself but mentally, right? When you cannot partake in day-to-day activities. As it can lead to infection, because of course with that skin being penetrated or lacerated but from the nails, that creates a opportunistic infection susceptible area for that infection to go in, whether it's bacterial, fungus, as we talked about, that can occur. So ingrown nails, you can try to cut it back. In most cases, it does recur without medical attention, since it is mostly from the shape of the nail or from damage that has been done permanently to the nail and grows out funny, digging into the skin. So cutting it back all the time could relieve it, right? But solving that problem wouldn't be likely without treatment. So some signs and symptoms for ingrown nails, again, very painful. Can feel sharp from the applied pressure. So in office, sometimes we touch a little bit, even it can be really, really excruciating, because if you picture that nail, that is pretty sharp at the edge, at the corner, just stabs right into the skin. So if we're touching that, it basically puts a little pressure on that sharpness going right into the skin, and that could really, really hurt. It can be red, of course, with that damage on the skin there. When there's infection, there you could see pus, and usually, again, it can be relieved from cutting off the nail border there of the offending nail spicules, but that might not be a permanent solution. So what causes that? There's a lot of different factors, starting with genetics. Some people are grown with more curved nails or pincer nails where it's rounded and curved in instead of flat. And that could be more susceptible in getting ingrown nails. Traumatized nail, especially to the nail matrix, that is the part where the nail grows out, usually the top of the nail. So, right behind the nail on the skin there underneath is the nail matrix. Sometimes dropping heavy stuff on it or, stubbing your toe, which damage that area, it can become, it can change its shape or thickens it. So that can, lead to a higher risk factor of developing ingrown nails down the road. Other factors such as wide nail plate can, more susceptible in growing into the skin. Tight shoes, right? Pretty self-explanatory. When it's squishing your toes together, your skin and nails are basically squished together, and that creates that risk there. And other stuff such as biomechanics, like your walking gait, can also trigger that as well. Of course, right? With for some, just a few examples, walking in-toed, changing that alignment can lead to more pressure on one side of the nail versus the other. Overpronation, meaning flattening of the feet, can put more pressure on the inside of the toe on one side versus the other. And again, that could, put your nail into more risk of becoming ingrown. So again, there's a lot of treatments for it. Palliative care, usually done by a chiropodist because it's very, very painful to go inside and cut that piece of nail out. Also, doing it safely without getting infection is hard as well. So we usually recommend visiting one of us to get that done with sterilized instruments, making sure that we can do it as bacterial, fungus, and any germs-free environment as possible. That would provide the relief instantly and reduce this chance from digging into the skin. Of course, if it's necessary, we might prescribe you some painkillers and antibiotics if there's infection. With something that you guys can do, of course, changing the footwear. If it's too tight, you find that it's squishing your toes together, you might want to find a little shoes with a wider toe box. There's options out there with nail braces. This one is very, very common back in the days, but we find really, really low success rate because with the nail brace, again, we talked about the damage being done more in the nail matrix where the nail grows out. Nail brace tries to open up that nail plate itself, which doesn't change the shape of the nail. So it reduces the pain in the meantime, but once that goes away or a nail comes back out without the use, it doesn't solve it. It's very temporary. With minor procedure is one of the most commonly done procedure in office. It very, very high success rate. We use something called either a total nail avulsion, removing the whole nail plate, or moving more common yet for this condition, partial nail avulsion, meaning we take only the side of the nail off, which I'll show you in the next few slides, how that's done. With matrixectomy, meaning we kill off the part where the problematic nail grows out, and that would resolve the issues pretty much permanently. Okay, so for the surgery itself, it's very quick and easy. It's usually done in office, takes about 15 minutes or less with the surgery itself. Of course, with the anesthetics, it varies between individuals whenever it sets in, so that takes some more time as well. So we usually book you in for more than 45 minutes, around 45 to an hour to get this procedure done, just in case there's any other complications. What we do is we basically remove that offending nail plate, such as here in the photo sees. We cut that off right to the roots, and we use some chemical, or there's other options if there's allergies of killing off that matrix where the problematic nail grows out. And then usually most people get great cosmetic results. It just looks a little narrower, the nail, but it looks pretty good. Very high success rate, very low risk. The risk pretty much is the infection, or sometimes in a small handful of people, there might be regrowth, but rarely the case. So as you can see here with the ingrown toenails, at first digging into the skin, and then after the surgery, that's immediately after the surgery. So your nail bed will grow back, the side of the skin will come back in, and it will look like a more normalized nail after the surgery. So the next slide is a little more graphic. In my opinion, is not too bad. It's just there's no blood, nothing, but it's just a heads up for you guys if you guys want to see the results of after the surgery. I'm going to show it now. So here he goes. So again, not too scary. There's nothing there. Basically shows you how sharp that nail is. Seeing that nail removed, there's a slight slit, only a slight slit, as you can see from above, right? But when we remove that nail plate, you can see how wide that is and how sharp the edge is. So picture that piece of, it looks like a knife, pretty much. Your nail is a knife digging right in, stabbing you every day with pressure. How debilitating and how painful that is. So removing that, and you go on to the next image on the right there, you can see the second image. Once it grows back out, it looks like a normal nail because the skin closes off. And then you won't get that irritation anymore. Okay, some of the other common in-office surgeries I do, we kind of mentioned that in full. Hammer toes, we call that tenoctomy, basically releasing the tendons if that's soft tissue causing the issue. We do warts removal, warts needling, only if conservative methods don't work, of course, and cyst removal as well. Of course, everything pertaining to the foot and ankle. So you can see that's hammer toe correcting it, right? Actually, bunions itself it's a huge factor when it's not treated, can cause hammer toe, because when it starts deviating, it overrides or underrides that second toe and pushes it up, and that creates the hammer toe. And the danger of hammer toe is that it can rub on the top of your shoe, causing a wound, and that can lead to infection, and it can be dangerous. So some wart needling here, introducing the virus into a deeper level, not harmful to your body, but it allows the body to register the virus, usually used in multiple warts. Once you get this done, your immune system would take care of the rest of the warts. Even if you have one in the hand, me treating the foot is like a miracle. That's what people said. Sometimes they touched it, it spread to the fingers. They're like, oh, I have it here and there. I see the doctor and I see you for this one, because they won't debride it. And then I said, you know what, opt for this quick needling procedure. And you don't even need to worry about the hand after, because me going into your foot at one place, after that, you see, the virus everywhere from your body gone, basically. Okay, so I think that's pretty much near the end of my presentation. Some of the FAQs you guys can read here. I put down the website at the bottom there as well. So if you're interested in looking into, again, we covered no doctor's referral, briefly mentioning that, and most private health insurance do cover our visit, and we can do medications and injections and a lot of different things pertaining to the foot. So yeah, thanks for listening.
Justin, that was very, very informative. Yeah. If anybody has any questions, that was very informative. Lots of detail I found. With some of these procedures that you do. I myself was intrigued. I wasn't, not always sure what goes on in the chiropodist office, and now I get a better understanding of it. So if you have any questions, please feel free to go ahead. I know we're just under the wire here of about an hour, so we really, really appreciate your patience, and again, a very intriguing topic. So Justin is very, very good with his craft. Any of my patients, my physio patients that have seen Justin have had nothing but great reviews and great results with Justin. And as with any practitioner, we try our best. We don't always have 100% success rate, but certainly those who have seen Justin can attest to his skill set. So if there are any questions right now or not, we can just remember that we'll put a recording up of the webinar on our website. So it usually takes a few days. I would say now with the holiday and all that, probably give it about a week, and we'll get it on there. So if you have anybody who's interested in this topic, you can go back and listen to Justin's great detail about about his craft. So Justin, do you have any other things you wanna add, or
Yeah.
we've
Okay.
missed?
So yeah. So pretty much. Thanks for listening. I had one previous webinar last time, as I mentioned. It is already up. So if you missed that, make sure to check that out. It goes into more detail of some why foot care is important, and why chiropody is needed, and what we do somewhere in that aspect. Also, again, feel free to type in any questions. If you have more personal questions, feel free to type in phone at your comment here if you don't want me to adjust them right now, and we'll make sure to get back to you through email to set up some phone consultation. Don't worry, it's free. I just want to hear you out, want to help you as much as possible, and even if you just want to say hi or just a quick question about something or about someone else, that you want to, or someone else of yours might want to have a question with me, feel free to let them know as well. They can contact us and I will get back to you guys.
So, so once again, thank you very much, everybody. We'll stop the webinar shortly, and I just want to say that I want to thank Justin personally for doing this. He's new to our clinic, as far as it's been less than a year, but has made great strides in establishing himself as a quality practitioner with a vast array of knowledge. So he means it when he says it. Give him a call. Just talk to him and say, hey, listen, I have a question, or have a family member who may need your services, and he's happy to chat. So thank you once again. Thank you, Justin. Thank you, all the participants. Enjoy the rest of the summer. We are sort of midway through the summer, but get out there and have a beer, a glass of wine, a fizzy water. I drank my mango bubbly here today, so that was great. And the chat now, and I will end the webinar. Thank you, everyone.
All right. Thank you. Thanks everyone.